Hello, class. Good afternoon. My name is Oghre. I'm a PMHNP student with Regis College. Welcome to today's presentation. We will explore obsessive compulsive disorder, its definition, symptoms, diagnoses, treatment, and implication to healthcare practice. So, what is OCD? Obsessive compulsive disorder is a long-term mental health condition that causes intrusive thoughts and repetitive behaviors. These are not habits or personality quirks. They are distressing and often take up hours of a person's day. According to the DSM-5, OCD symptoms must cause significant distress or interfere with the daily life to meet the diagnosis of OCD. The cycle of OCD usually starts with obsessive thoughts that create anxiety. To reduce the anxiety, the person feels driven to do certain behaviors such as checking, counting, or cleaning. While this may bring short-term relief, the anxiety quickly returns and the cycle repeats itself. Many people with OCD feel ashamed to talk about their symptoms. That is why nurse practitioners must respond with understanding, not judgment, to help patients feel safe about opening up. So, how do we diagnose OCD? Diagnosing OCD requires careful clinical assessment tools such as the Yale-Brown Obsessive Compulsive Scale, which helps to determine how severe the symptoms are. Nurse practitioners often play a key role in recognizing warning signs, especially in primary care settings where patients often come to seek help. The most effective therapy is called exposure and response prevention, ERP therapy, which helps people face their fears about compulsions. SSRIs are usually the first medications used to manage symptoms. Nurse practitioners play a vital role in supporting patients by checking for side effects, encouraging medication adherence, and offering reassurance. Helping patients stay engaged in treatment can make a big difference in recovery. Psychiatric mental health nurse practitioners and family nurse practitioners, as well as nurses, are often the first to notice signs of OCD. A patient may seem overly anxious, repeat questions, or describe time consuming routines that interfere with their daily life. Even with limited mental health training, nurse practitioners are in a strong position to ask questions and guide patients towards help. OCD is often misunderstood, and many patients feel embarrassed about their thoughts or behaviors. Nurse practitioners can help make a huge impact by just listening without judgment, showing empathy, and explaining that OCD is a real treatable condition. Your support can be the turning point that encourages someone with OCD to seek professional treatment. OCD is not just something we see in the mental health care settings. It shows up in emergency rooms, outpatient clinics, and everyday healthcare settings. This is why all nurse practitioners, no matter your specialty, need to know how to spot the signs and symptoms of OCD to provide healthcare support. New tools like online CBT programs and genetic research are changing how we understand and treat OCD. But even with these advances, nurse practitioners play an essential role in ensuring that patients with OCD get adequate healthcare support. We are the ones who listen, explain, and stand by our patients throughout their journey in treatment. The more confident and informed we are about OCD, the more we can help to reduce the stigma and improve outcomes for patients suffering from this mental health problem. In conclusion, prompt diagnosis and early intervention are key to improving outcomes and preventing OCD symptoms from becoming more persistent and disabling. Cognitive behavioral therapy, especially with exposure and response prevention, is the most effective treatment. For those who need additional support, SSRIs can help manage ongoing symptoms. Collaborative care planning ensures treatment is tailored to each individual's needs and encourages long term engagement. When patients are involved in decisions, adherence and outcomes both improve. Relapse prevention is crucial. Regular follow ups, medication adjustment, and ongoing therapy all contribute to lasting progress. With the right support and professional approach, individuals with OCD can achieve meaningful recovery and an improved quality of life. Thank you for listening to my presentation today and have a good evening.